Let's go into my clinic. We'll inject temples today. Temples are one of the most dangerous areas to inject. I'm going to use Bellafill, and the benefit is that you don't have to keep coming back for it. So the more you inject the temple, the more you have to come back every year. If you use a short-term filler, then that adds danger. The less I have to inject it, the better. We're going to look at a before and after of this procedure, and I'll also take you through the exact cost. You may ask about fat and fat transfer, but fat is one of the most unpredictable treatments we do. Otherwise, we'd be injecting lips with fat instead of lip filler. But Bellafill is long lasting, so my patients often never have to come back once we do about 2 to 3 vials per side. Let's pop into the clinic and I'll show you the injections. This is a temple, and you see the temple hollowing creates an aged look, and it brings the edge of the brow up. However, a brow that's lifted at the edge is a youthful look. Everyone's trying to get it lifted, be it Botox, be it threads, and people don't inject the temple because they're scared of it. I do it every single day in clinic. Let's pop in and I'll show you exactly the injections. Okay, so I'm going to do Bellafill in the temples. Bellafill is a longer lasting product, so a lot of people like that about it. And I'm going to inject it in the temple because the temporal hollow, if it gets too deep, of course, it makes an aging look, but also can affect the way the cheek looks, just like the preauricular hollow. So there's a few layers here. Of course, we got to pay attention to zygomatic bone. We have the skin, a fat layer, 2 layers of temporalis fascia with a space in between, the temporalis muscle, which people chew with, and that creates some of the discomfort for a day or 2 afterwards. And then we're on periosteum near the bone. So this doesn't usually take too long. What I'm going to do, I'll tilt you this way. I come in just above the bone because that's the most avascular area. So you'll get a little bit of a stick here. And what I'm feeling here, I can feel right there a pop through the superficial temporalis fascia. I'm in between deep temporalis fascia and then up on to the periosteum here. Why here? We want to ultimately lift that edge of the brow. And then I'm going to inject some product. I'm on the bony layer. There's many ways to do it. With Bellafill, it's not an aspirational product, meaning I don't aspirate from it. I'm putting micro boluses. And I'm just injecting small aliquots. Now, it is a biostimulator, a collagen stimulator, so you get an immediate effect and then a long-term effect. I'm going to massage it up and get above this area too. It could be injected higher. Why not the shotgun approach? Because the superficial temporal artery is right there. So anatomically, to me, this is a safer way to inject it. And this is 1 syringe. In that syringe, if you're in the right plane, you'll see there is 0 blood. Okay, so I'm in the right plane. Then I'm just going to massage it up. There's not much post-care after this injection. I do a lot of these injections. How are you doing? You doing okay? You can feel it into your jaw, and that's normal if that's what you're feeling. So now these beads will stay in there. The collagen that was in here will go away after 6 to 8 weeks, and the beads will build its collagen, help lift and volumize this area for a long-term effect studied over to the 5-year level and more. The other thing it's approved for is acne scarring. So a lot of people know Bellafill from acne scarring. We have 1 more syringe, and we'll inject this side as well. Of course, I look at symmetry so that I look at both sides in case we need one more in one side than another. Okay, I'm going to tilt you this way. We prime our syringe, and it's the same idea. Coming in above the zygomatic bone, we'll stick here through both layers of fascia onto the periosteum, and it can be a little tender. And then injecting right at the edge of that brow. It's so important because the edge of the brow, as that elevates, it says youthful. It says that her eyebrow is lifted, and it helps with the skin above the eye. And again, small aliquots onto the bone. Doing okay? Mm-hmm. These injections don't take a long time to perform, but anatomical knowledge is key. Very few people use Bellafill. Again, I'm expecting no blood because I'm in the exact plane. You deviate from that and you don't expect that. And then I'm going to massage here. So a lot of people like long lasting, and the least amount of times they need to inject the temple, the safer it is. So if I'm injecting that every year with a hyaluronic acid filler, that increases her risk. She's getting injected every year. I have patients out 5, 10, 12, 15 years. The total dose for the average person is about a couple vials per side. And one vial average cost in the United States about $1,000. So it's $4,000 or $5,000. People do use fat transfer. The problem with fat transfer, often it doesn't take. Some do regenerate through stem cells, but in general, I treat a lot of people with this product where fat has failed. So that's Bellafill. How's the discomfort there?
Absolutely no discomfort.
So you get an idea. This is why people like minimally invasive facial aesthetic procedures, because you can go out tonight, girl. There's not a spot of blood.
Yeah,
And
I
that's
would
the beauty
take
of it.
this any day over any kind of surgery.
Yeah, that's your choice, right? You just don't want surgery, and you can get out and do a few little things and enjoy. Now here is a before and after, and you can see the edge of the brow nicely lifted. The temple is more full, and that gives an attractive look. So here's a full face before and after. On the before over here, this was 2 years ago, and I brought her back just to do the Bellafill temples, but we are going to repeat the complete plasma sculpt procedure here at year 2. So I will repeat everything. I'll just put a little PRF under the eyes, maybe some plasma fill. You can see we already softened up the nasolabial folds, but we can soften them further. And on the nasal ala here, on her after, I want to bring that more forward. Also want to reduce the distance a little bit in the ergotrid and just help a little bit with the jowl. Although we softened it here, we can do a better job. So that's my plan. Now, when someone doesn't have to come in and do this all the time, in fact, maybe never again after we get it how we want it, that's a satisfactory procedure, and it's very cost effective. So many people don't use Bellafill because it's long term and they're scared of it, but I submit the opposite. The more I use short term products, the more they have to come in and get injected every year, and that, I think, adds a dangerous factor. Imagine getting your temple injected every year. Not only do you don't want the discomfort, but you don't want the expense, and you don't want the danger of that. So be careful what you're scared about. So many people are scared about things that don't exist. It's just something that's been perpetuated over time. And understand the benefit of long term. I put a complete video up here on full face injections so you can see before and afters and what the full face looks like for this patient prior to us doing the temple injections. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.